Welcome back to EP in Practice. Today we're going to talk about atrial fibrillation and its risk factors. So we're going to have a look at some of the risk factors that impact AF risk, AF burden and symptomology. And we'll also have a look at how modifying these risk factors, whether or not that impacts on AF risk, AF burden and symptomology. I had a lot of fun putting this talk together as I started to realize that basically everything impacts AF risk, particularly lifestyle factors and behavioral factors. And so a lot of AF risk is within our control to some extent, of course. So there are many cardiovascular risk factors that we all know: hypertension, coronary artery disease, heart failure, the presence of pulmonary hypertension, stress, diabetes, metabolic syndrome, chronic kidney disease. All these kind of things impact the cardiac health, and they're associated with cardiac remodeling. And anything that causes cardiac remodeling is associated with a risk of atrial fibrillation. So many of these risk factors are modifiable, such as diabetes and cardiovascular disease are modifiable to some extent. Some of them are more modifiable than others. So some are impacted heavily by genetics, like cardiovascular disease, for example, although it is modified by behavioral choices and lifestyle. But also things like alcohol intake, diet, obesity, sedentary behaviors, lack of physical exercise, lack of physical activity, or the absence of sedentary behavior. All these things are heavily modifiable risk factors that do impact on atrial fibrillation risk, independently of your other risk factors. So the current thinking is that if you are diagnosed with atrial fibrillation and at some age, probably at a fairly young age, and if you have good behavior choices and lifestyle, so you get enough sleep, you don't have diabetes, you have a good diet, you have enough physical activity and exercise, and you've got blood pressure and lipids under control, that sort of thing, then your risk of developing higher burdens of AF that impact on your quality of life is fairly low. Whereas if you have poor risk factor management, so you've got hypertension, diabetes, you've got coronary artery disease, you're having heart attacks, you smoke, that sort of thing, then you will have more and more atrial fibrillation risk. Atrial fibrillation burden will increase and increase as that results in structural remodeling. These risk factors structurally remodel the heart in a maladaptive way over time, and that will increase your risk of atrial fibrillation, increase the risk of having a higher AF burden, which will impact on your quality of life. Not to mention all those other risk factors which also impact on your quality of life in other ways. So the current kind of thinking is that AF risk and burden increases with increasing risk factors, and that the management or alleviation of these risk factors can mitigate and sometimes prevent atrial fibrillation from occurring. So we have to look beyond simply the left atrium to manage atrial fibrillation effectively. So this is an incredibly important slide that I've shown in a different lecture, and it shows the many determinants of AF risk factors. So behaviors and lifestyle choices, including stress, sleep, obesity, physical activity, a poor diet, all of these significantly impact on atrial fibrillation risk. So it's important to manage stress, to improve and maintain physical activity, to reduce sedentary behaviors, and to maintain good diet and health, that sort of thing. And the risk of atrial fibrillation tends to go up the older you get, so it tends to be an older person's disease. Sometimes you do get 30, 40-year-olds that present with atrial fibrillation, even if they don't have too many risk factors. But certainly beyond the age of 65 years old, atrial fibrillation risk seems to increase exponentially. And you can see some of these statistics here showing what kind of burden atrial fibrillation has on the US population, for example. And some of these risk factors that you can see here are quite modifiable with behavior changes. When we talk about atrial fibrillation management, we sort of talk about 4 pillars of atrial fibrillation management. So the first pillar is lifestyle and risk factor modification, which is what the focus of this talk is going to be. The second pillar is going to be mitigating the thromboembolic consequences of atrial fibrillation, so anticoagulation and preventing strokes. The third pillar would be to reduce symptoms or risk of tachycardia-mediated cardiomyopathy with rate control strategies, or to maintain sinus rhythm and prevent atrial fibrillation from occurring as much as possible, and that would be through rhythm control strategy. And what about obesity and weight loss? So obesity is definitely associated with atrial fibrillation, as it increases the adiposity of the myocardium, which disrupts depolarization and repolarization and predisposes the myocardium to atrial fibrillation, where you can get localized reentry. In animal models, if you overfeed pigs, they have greater incidence of spontaneous AF episodes. And it's thought that fatty infiltration also promotes local inflammatory markers around the myocardium. And remember, local inflammatory markers predispose fibrotic deposition in the myocardium. And so that fibrosis also predisposes to scar, and that scar increases the risk of atrial fibrillation. Obesity is also associated with many risk factors which cause atrial fibrillation. So people who are obese tend to have a number of pathophysiological mechanisms that result in hypertension and coronary artery disease. That can result in ischemic heart disease and heart failure, as well as renal dysfunction. It can also result in diabetes and systemic inflammation. And all of those things feed into increased risk of atrial fibrillation. Now, really importantly, for patients who do have atrial fibrillation and are overweight, lowering their BMI is associated with lowering their risk of AF disease progression. So, and in fact, there's some data to say that reducing your weight actually reduces the amount of atrial fibrillation that you have. So not only do you arrest the progression of AF disease, or the transition from paroxysmal to persistent to permanent AF, but you actually can reverse AF disease partly, at least. And so this is data from South Australia, and it showed that patients who have less than 3% weight loss or gain, so they don't change their weight, about half of them progress from paroxysmal to persistent AF. But for patients who have more than 10% weight loss, only 3% of patients have disease progression. So that's a big difference. Now, in terms of disease reversal, so this is a change from persistent AF to paroxysmal or no AF, patients who don't have any weight loss or gain, not many of them, about a quarter of them have disease reversal, whereas almost every patient who lost 10% of their body mass or resulted in disease regression. And so they changed from persistent AF to paroxysmal or no AF at all. And so that's really important to know, in that we should be encouraging patients to lose weight and take control of their obesity and get into a healthy range, as this can both arrest the progression of AF disease and also reverse AF disease. So patients who demonstrate weight loss have been demonstrated to reduce their AF burden. So patients who have increased weight loss due to diet and exercise modifications, these patients have a reduction in their AF symptoms as well as an absolute reduction in their AF burden. Fewer patients with weight loss have disease progression, and many of these patients experience a regression in their AF disease, which is really promising and optimistic. And this really just highlights the importance of modifying lifestyle when attempting to manage atrial fibrillation and reduce AF symptoms and burden. Independently of obesity or healthy weight, what impact does physical activity and sedentary behavior have on atrial fibrillation? So a sedentary lifestyle has a bit of an impact on atrial fibrillation risk. So chronic inactivity is associated with a higher risk of metabolic syndrome, including glucose intolerance, diabetes, vascular inflammation, central adiposity, weight gain, and autonomic dysregulation. So all of these things kind of represent risk factors for atrial fibrillation because they're associated with maladaptive cardiac remodeling and fibrofatty infiltration of myocardium. Something that I find really interesting is that sedentary lifestyle or inactivity seems to be a risk factor for atrial fibrillation independently on whether or not you meet the prescribed exercise guidelines. So if you exercise for 30 minutes 5 days a week, which is kind of what is recommended if you're doing moderate exercise, and the rest of the time you sit at your desk and you don't move around, you're just sitting down, and then you go home and then you sit down and you eat dinner and then you sit down and watch the TV, and then you do your 30 minutes of exercise, and then you go to bed, and then you sit down and drive to work the next day, and you're just doing all this sitting. It seems to be that this is still a risk factor for atrial fibrillation. So we need to also be cognizant of how much we are sedentary, even if we are reasonably fit or meeting exercise guidelines. And there's a fair bit of evidence to show that the more sedentary you are, the higher the risk of atrial fibrillation you have, whereas the least sedentary people in this group of older women had the lowest risk of atrial fibrillation. So this is an exit site EGM example.